Support for Headline Humboldt is made possible in part by viewers like you. Thank you.
Coming up next on Headline Humboldt, Caltrans has finished the first phase of its project to improve and make safer the Indianola Cutoff along U.S. Highway 101. We'll have an update. Also, we interview two folks who are working hard to reduce and prevent suicides in Humboldt County, with a particular focus this week on making the means to do so less accessible to at-risk individuals. Coming up now on Headline Humboldt. From the top of Humboldt Hill, this is Headline Humboldt. I'm James Falk. Thanks for joining us. One local issue of concern that has been in the headlines almost precisely as long as I have been a reporter here in Humboldt County is Indianola Cutoff. In 2001, fresh out of college, it was one of my first assignments. A sedan had made a California stop at the intersections of Indianola Road and the highway, slowing but not stopping, trying to beat the oncoming traffic. There was only one vehicle close, but it was too close to stop. The T-bone collision that ensued ultimately left 4 people dead, their necks snapped by the force of this ferocious crash. Shards of safety glass and baseball cards littered the road when I arrived with the photographer in tow. It was surreal, a late afternoon transitioning into evening, and I remember that the thought of taking notes seemed utterly ridiculous. My pen had green ink. An effort began that very week to do something, anything that would make this deadly intersection more safe for the many motorists who passed it every year. They slowed people down, made it a double fine zone, issued countless traffic tickets, doing what they could to mitigate the risk. But the big fix, the long game, was years out and everybody knew it. Well, now more than 2 decades later, phase 1 of this project is now complete, and the second phase is set to start. The gears of government may grind slow, but they do work, as long as the money is there. Later in the show, we'll sit down with health education specialist Jonathan Abadari and Rex Marini, the community outreach coordinator for the VA, to talk about the issue of suicide in Humboldt County and what can be done to reduce its likelihood by keeping the means under better control. But first, the news. At this week's Eureka City Council meeting, the council heard from staff on its homeless intervention programs and the success they've had that's been noticed by the Humboldt County Grand Jury. The Grand Jury issued a report earlier this year about the county's homeless programs, Humboldt County, behavioral health and substance use, and the streets, what works. In that report, the Grand Jury repeatedly pointed to efforts made in the city of Eureka and how those programs have proven effective in the field. Eureka mental health clinician Jacob Rosen told the council the city's success hinges on the willingness of the Eureka Police Department to stay engaged on this issue and work with anyone willing to roll up their sleeves. More needs to be done, and the existing programs need more secure funding, he said, but the effort is making progress.
I'm tearing up. When I first landed in this county, I was doing outreach with youth on the streets, and I saw too many people run right up against a wall. And just to know that the work that the city's doing to remove those walls and to give people a hand up out of some really desperate times is exactly the kind of work I think we should be doing. Thank you.
This is something I was marginally aware of what the city was doing prior to my election, and then have become so much more aware of all the work that you guys are involved in and all the different things. And it's so remarkable to me that such a small city is doing so much in this area, and it is unique. It's truly unique. And it's entirely because of you guys and, Commander LaFrance and these different people who have organize this. And I think it's really something just to kind of see how you guys have created this warm, I don't know, I think like this, trying to kind of wrap people in a warm blanket, like this sense of safety and sense of community, and to kind of make people feel as though there's a net and that people care about them. So I just, I frequently brag on our staff here because, you get to know people and you think, wow, these people are awesome. But I just deeply appreciate all of you guys and what you're doing.
Caltrans has finished the first phase of its long-running project to make the Indianola Cutoff and surrounding highways safer for motorists. The Eureka-Arcata US 101 Corridor Improvement Project was initially conceived following a high number of fatal and injury collisions at the site, including, as I said, a 4-person fatality in 2001. After many years, much bureaucratic wrangling, and a mountain of hard work, the first phase is finished. The second phase began this week, and of course it comes with new traffic restrictions, as anyone driving that way this week will have noticed. The Indianola Cutoff median is now closed, restricting southbound access. Motorists can still reach the Indianola Cutoff from the northern side. This change will be in effect for the duration of the project. Ultimately, by the end of 2025, a new bridge will be in place and an extended Indianola Cutoff will run beneath it. No more intersection. Here's a project update and description from Caltrans' Facebook page.
And today we're out here on the construction site for the Indianola Undercrossing project. We've completed stage 1 of construction, and behind me you see what we call the northbound detour, where the existing northbound alignment and traffic has been shifted over to the east. And now we will begin stage 2 of construction for the project. In stage 2 of construction, we're going to do a few things. One of those is continue installation of the concrete columns into the ground to improve the soil strength, since we're dealing with extremely soft soils out here on the project site. We have approximately 60% of them placed, with 40% remaining. We'll also be removing the existing northbound lanes I'm standing on today. We'll begin placing fill for the embankment for the approaches to the structure, and we will also begin work on the structure foundation with the installation of 2-foot diameter concrete piles approximately 90 feet in depth, and we'll be placing about 120 of them. We also want to bring an important traffic control update to the public. Last year, we closed the westbound Indianola movement, turning left onto southbound 101. We will now be closing the week of September 2nd, the southbound 101 movement, turning left onto Indianola, going in the westbound direction. With all the activity going in the median, with large equipment, work on the embankments and placing fill, work on the structure's foundation, there will be a lot of distractions and impediments to visibility for sight distance. So in the interest of safety for the traveling public and our workers, we will be closing that movement. We want to remind the public we do have a 40-mile-an-hour speed limit posted throughout the construction zone. Please adhere to that speed limit for your safety and the safety of our workers. We'll continue to bring you traffic updates and construction updates as the project unfolds, and we're excited to bring this crucial safety project to the community. Thank you.
We'll be right back after this short break.
Thank you, North Coast Journal readers. We're honored to be voted Humboldt's best television station.
Thank you so much.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you so much.
Thank you.
Thank you.
KEET, your PBS station for the North Coast of California.
Thank you.
Hey parents, bring your kids to our exciting Make It Float workshop on Sunday, September 15th at 10 a.m. at the Jefferson Community Center in Eureka. We'll kick things off with a fun clip from the new Ken Burns documentary, Leonardo da Vinci. With hands-on instruction, your kids will learn to make tinfoil and marbles float on water. Stick around for more awesome Da Vinci activities and the thrilling Kinetic Classic beginning at noon. Register at KEET.org.
Joining us now in studio is Health Education Specialist Jonathan Abadari and Community Outreach Coordinator Elizabeth Rose Marini to talk about suicide and how to best protect your loved ones in the home. Welcome, guys.
Thank you.
Yeah,
Thanks for having us.
So, there's the issue of suicide is a difficult one to talk about. So I applaud you guys coming out to, come on the show and talk about it, and also the work that you guys do. Now, this is September is National Suicide Prevention Awareness Month, correct?
Yes,
That's
it
right.
is.
And there's a ton of events planned throughout the community, and we'll talk a little bit about those as we go on. But let's start with you, Jonathan. I know that Humboldt County, like in a lot of things, Humboldt County doesn't rank very well in terms of suicide. I think we have a relatively high number of suicides. Can you talk a little bit about that and how it impacts our community?
Sure. We do have a relatively high rate of suicide as compared to the rest of the state of California. I think we rank about 5th overall in California counties. And there's several things that might go into that. One is just the remoteness of many areas of the county, make it easy for people to be living in situations where they're relatively isolated and hard for them to access services that might help them to get through a suicidal crisis without having to make a suicide attempt. So that's part of the reason.
Yeah.
Another part of the reason is we have a relatively depressed economy compared to some other places.
Absolutely.
So
Yeah.
there are some difficulties that people encounter that are kind of unique to Humboldt County that I think may move that upwards. The biggest sort of thing that contributes to our high suicide rate is suicide death by firearm. It's a really unfortunate reality, but that makes up about half of our overall suicide deaths, which is a trend that also holds true nationally.
Now, you guys are doing a program to kind of hopefully bring that number down a little bit, and I want to get there in just a second. But first, Elizabeth, you work with the VA, and I was sort of intrigued by that. What is the VA's role in this kind of work, and is it national or is it specific to Humboldt County? And what is it that the VA is concerned about?
Well, suicide prevention for veterans remains our #1 clinical priority, simply for the reason that veterans are, well, in terms of national statistics, about twice as likely to take their own lives.
Wow.
Here in the state of California, because we have so many veterans who live here, either they were from here in the beginning or they want to move here after they discharge from the service, it's significantly higher than that. It's about double again what the national rate is.
Yeah.
Unfortunately, here in Humboldt County, it's about 6.5 times the rate of the state. Now, we're a fairly small population county. That isn't necessarily a large group of people, but any one is one death too many.
Yeah.
So we're very concerned about that. My position, we are all across the nation, in every area that the VA serves, and internationally. We have people, I have colleagues who cover Hawaii, Guam, and the Marshall Islands.
Wow.
So we are really trying to help communities address this. You know, we have clinicians internally when veterans come to us in need or as a result of a hospitalization who need help. But where it's happening really is out in the community.
Yeah.
We only see nationwide about 63% of all veterans at the VA. And there's a whole bunch of reasons for that. Some are good, some are not so good.
Yeah.
But here in our county, we only see about 30%.
Wow.
Yeah. Yeah,
So only 30% of the people are taking advantage of the services that they're owed,
Right,
basically.
Right, exactly.
Yeah.
Yeah, so one, of course, we want to get the word out, but also in a county that has some of the issues that Jonathan mentioned, where people have difficulty because they're extremely rural, accessing these services. We also want to educate and partner with all of the community clinics, making sure they know, more about the veteran population, and particularly the issue we're talking about today, keeping means safer, particularly with firearms, because that is the #1 cause. And among especially male veterans, it's about 75% of the choice that they make to end their lives.
So, on that front then, you guys have a program where people can actually get gun safes for themselves for free, is that right?
That's right.
So how does that work?
So it's called the Keep It Safe program. It's a joint operation between my program, which is suicide and violence prevention, and another public health program, which is substance use prevention. So we partnered on this project to use our funds to secure large numbers of free locking devices we can give to the public.
Yeah.
We just have asked the public, anyone who wants a lockbox, take a survey. It's just a quick demographic survey. It's about a page and a half, takes 30 seconds, and then they can walk away with the lockbox.
Yeah.
It is a TSA and California Department of Justice approved for storing a firearm. And we believe that there's importance to distributing these kind of secure storage devices for several reasons when it comes to reducing suicide.
Yeah, please.
One is that just putting time and distance between a person who's experiencing a suicidal crisis and the means by which they might attempt to take their life can in and of itself be a factor that causes them to change their mind.
Second thoughts, right? People might be able to reconsider in that
The
time.
more boundaries or barriers there are between a person and the method that they've chosen, the more time they have to reconsider. We also like these locking devices. They come with a key because in the event that somebody thinks that, or maybe they have someone in their life who can support them to this and they have a conversation with somebody, they can hand the keys to another person to hold on to them until such time as they feel that they can take it back and can be responsible for it again. So we've partnered with a lot of community agencies, as Elizabeth was saying, clinics, community resource centers, but also with firearm retailers and ranges who've been major partners for us in distributing these lockboxes.
Yeah.
We partner with Ballistic Precision, Pacific Outfitters, RMI, Buck Sport, Ace Hardware in Fortuna. We've worked with Kevin Christie, who manages Ace Hardware here in Eureka, to attend one of the NRA benefit dinners. And so we've had really strong partnership from our firearms community as well. And they tend to really stand with us in emphasizing the importance of responsibility for firearm ownership. And it's also not only for firearm owners, but it's responsibility for the rest of the community as well.
Well, I was just basically going to ask that. Like, if you have a pistol or a gun and you want to keep it safe, it's not just if you think you're ever going to be, suicidal. It's so no one else can access your gun, and that it sort of takes that option off the table for anyone, right? I mean,
absolutely.
Yeah.
It's not only for the gun owner; it's also for anybody else who's in the household or has access to the household. This kind of secure storage is especially important when we consider things like youth suicide, because the unfortunate reality is that a majority of youth suicides are attempted or end in a death with someone else's firearm, if they're done by firearm, that is. So, and that's usually a family member's gun in that case. So secure storage is extremely important on that level as well.
now there's the other lethal means that is probably prevalent would be like medications and stuff, right? Like if you have narcotics or sleeping medication, that should be something. You guys have anything to offer folks in that regard, or?
We do.
Go ahead,
Well, no, collectively. I mean, a lot more of the program actually falls on Jonathan's side because he's a county public health, whereas I only work for one agency. But it happens our populations, got a lot of relationship to these problems that we're discussing.
Yeah.
So there are, of course, you can use the lock boxes for safely locking up medications.
That's there you go. I mean,
for example, we also have take-back programs throughout the county at pharmacies. Our clinic has one. Pretty much any clinic in Humboldt has one, so you can take old, expired, or no longer using medications there. For our homeless population, because of Jonathan's program, we were able to give out lock boxes to a lot of our homeless veterans so that they can keep their medications secure if they happen to be in a roommate situation as they go through the housing process.
Yeah, and this is another thing where, like with the guns, I mean, keeping these things secure isn't just about suicide, although that's where you guys are directed right now.
Right.
It's also just sound practice because it can prevent so many downstream catastrophes, right?
Yes, exactly.
Absolutely, and that's why we really try to emphasize that our work is in the prevention category, trying to prevent things, as you were saying, upstream of a crisis actually occurring. If we can make sure that all of the things that would go into a death happening are not there, then we can prevent that death maybe even before a crisis arrives in somebody's life, if the community is practicing these things together.
Yeah. Now, one of the things I wanted to ask you guys about, well, first of all, Jonathan, I was surprised to learn that there is a multi-person team of people within the county dedicated to this work. Can you talk a little bit about your department and the kind of work that you guys do broadly to reduce suicide in Humboldt County?
Sure. My team is Humboldt County Public Health Suicide and Violence Prevention Program. I have my colleagues Allie Knoll, Lex Sieber, Kristen Smith, and Melissa Reed. We all work together on this, and we kind of specialize in different areas. I specialize more in the lethal means safety, lockbox distribution aspect of things. We also offer trainings to the community for suicide prevention. And these include things like how to recognize signs of suicide, how to have a supportive conversation with someone, what the resources are we can refer somebody to if they're going through a suicidal crisis, but also how to be a support to people ourselves and how the community can support people, because oftentimes, as I was talking about earlier, people may be in isolated situations where they can't necessarily access professional services for support. So it's very important here that we as a community learn and practice ways of supporting each other.
Yeah, and now you guys are both, as part of your entities, part of the Suicide Prevention Network. Elizabeth, can you talk a little bit about what that program is and how it sort of gets more than one agency involved and makes a collective effort?
Yeah, absolutely. I had previously come into contact with the Suicide Prevention Network from my original job with VA, which was doing homeless services. So when I moved over to the coordinator position, I got to come on much more frequently. And it is a large organization. I have a hard time thinking of anyone who doesn't have some representation in it, right? We have people from pretty much all of our clinic providers, as well as many other agencies like our youth agencies and so many more that come together every other month for a general meeting to discuss things like, some of the initiatives and events that you're going to talk about a little bit later, how to make those happen, where we can improve them, as well as to look at what, the statistics are saying, right? And what does that mean in terms of the work that we need to do together to address whatever is coming up, whatever's changing as we go forward. So,
and that's one of the things I wanted to talk to you a little bit about is like, who are the people that are most vulnerable in our community, and is it in particular group, segments of the population? What's a high risk segment of the population that people should be aware of?
Well, there are some disparities in suicide between different populations, as you said, but really suicide risk can't be narrowed down to any particular demographic or even to a lot of things that are generally associated with it, like mental illness. People who take their lives, I believe it's only about half have a diagnosed mental illness at the time of dying by suicide or making a suicide attempt. So it's kind of hard to categorize, and that makes suicide prevention and doing intervention in crises a little bit difficult. I will say that there are certainly signs that somebody may be considering suicide. When people are considering suicide, they do tend to talk about it and they do tend to mention it. They may give direct or indirect verbal cues, and there are also behavioral cues to watch out for, such as when a person is giving away valued possessions, if they are not taking interest in hobbies that they usually would take interest in, if they're starting to let down deadlines or not perform well at work, they're not hanging out with their friends like they used to, so basically isolation, withdrawal. These kinds of things, if you see multiple sort of things like that happening, that's when we want people to be concerned and to have a conversation and to ask someone a direct question in that conversation of whether they're thinking of suicide. There's a lot of...
So don't just say, is something bothering you? Actually go right at it.
And ask that question directly, are you thinking of suicide? A lot of people are afraid of that. There's a myth that we think we're suggesting it to someone. We're not. It's almost always a relief for that person.
That was actually a question I had. Is it a risk to ask somebody?
No. No, it's not. I mean, a lot of studies have been done on that. And as far as we can see, there's no real correlation. In fact, most people actually report being relieved to have a chance to be honest about how they're feeling. Because you can only imagine, the tremendous pressure people might be feeling internally that's causing them to think of this as a solution to their problems. So having someone say, look, I'm willing to hear the most difficult thing you could possibly tell another person, please tell me, can be a tremendous relief, and they generally will tell you.
That's another interesting question. It's like if someone says that they're thinking about it, but they're not going to do anything about it, and they may confide in you, but they're still going ahead with that consideration, what can you do then? Jonathan?
Well, there's a couple different things you can do. You can give them a referral to resources to help. So we do try to promote the 988 suicide crisis.
If anyone has an issue, they're considering suicide or knows someone, is that right?
Yes.
Who may be considering suicide, you can call pound 988?
Correct. Right? Yes. I think it's just 988. You don't need to dial
just
pound.
988,
And it was chosen for the similarity to that and for the ease of being able to remember. And there you can speak with the trained crisis counselor. It's 24 hours a day, and that's a national hotline. We also have some local resources here in Humboldt County that people can avail themselves of and that you can refer someone to. But in some situations, a person may not be willing to speak to resources, or they may not have access. If you're in a remote area, you may not be able to make that call at any given moment. So we really want to emphasize that when you're having a conversation with someone who's considering suicide and you're talking about that, in that moment when they're there with you, they're safe when you're having that conversation. So the conversation doesn't need to be about what's the right resource or how do we fix this immediately, but how do we keep you safe for the time being until we can get you to whatever's going to be the best source of help for you, right? Because it may not be the crisis lifeline. It may well be, right? And that's an excellent resource that we want to promote as much as possible because it's really good for us here because it's available 24 hours a day, 7 days a week, and it puts you in touch with a trained counselor. But people still may in certain situations not be willing to engage with that. Yeah. They might be isolated out somewhere in the county, and they might say, I really need to speak to a certain person from their life, that they can't get access to. So setting that up, if it's a faith leader, if it's a former teacher, if it is just an old friend that they can't travel the distance to see or something like that. These things are really important. Building a team to support somebody that they have agency in choosing is what we really try to recommend, because we have to be realistic about the chance of accessing resources in a timely fashion here in Humboldt County. Yeah. Aside from just the lifeline.
And potentially someone they trust, right? I mean,
right.
So you want to have someone that can actually get through, and it won't be just a surface polite conversation.
Right.
A little bit deeper than that. So we only have a couple minutes left. I wanted to talk about a couple of events you guys have coming up. For the month, there is the Holding Space event, which is actually tonight at Garberville Town Square. And then there's the Out of the Darkness Community Walk on Sunday at the Arcata Plaza.
Yes.
What's that about, Elizabeth? Can you tell us?
It's from 9 to 1, and people can register on site as well as just going to afsp.org. And it is a wonderful community event. One, the walking raises funds for AFSP, which is a partner to all of us who do suicide prevention work. They do a lot of research. They create a lot of materials, which they generously provide to everyone engaged in the work. So raising funds to help continue that work is definitely a priority for all of us. Yeah. But they also put together a tremendous amount of resources where people can connect with each other, where they can begin to kind of process and heal, where they can hear from other people who've been through this experience. We do have speakers, there's music, there's some wonderful events where you can do things like, hang a little tag on a tree with good wishes for that person, wherever they may be. So there's some really nice community connection parts of that event.
And memorializing it sounds like, and helping people process if they've been through this.
People can bring pictures, people make posters, and some of them are really charming. Yeah,
that's registration opens at 9 a.m. This Sunday, this weekend, and opening ceremony begins at 10 a.m. I encourage people to go to that. We have 30 seconds left. Real quick, if someone wants to help and they don't have, what can people do if they're just living a normal life and they want to try and help?
I think they should join the Suicide Prevention Network if they want to get involved with sort of the work that we're doing, because the network connects people from across the county, and it would connect them to lots of different people who are working in sort of many different fields, but who are all interested in doing suicide prevention. If they start coming to some network meetings, which they can sign up for on our website, the Humboldt County Public Health Suicide and Violence Prevention website can direct them to signing up for the Suicide Prevention Network. Start coming to the meetings, and soon enough, if you have the will to start working, there will be a place for you to do it. Yeah.
Yes,
and you
we
can
will.
get there from humgov.org, right?
Yes, you can from our website.
Okay.
Yes.
Well, that's all our time. Thank you guys for coming and for doing this vital work. I deeply respect and appreciate what you guys are doing. So, thank you.
Thank you very much.
Thank you for giving us.
No problem. That's it for this week. If you're interested in fantastic and challenging conversations, check out our newest Neon Galactic interview with psychologist Dr. Dean Radin, whose long-running experimental work has proven with a high degree of statistical certainty that humans can and do exhibit abilities long considered impossible. That's at youtube.com/@neongalactic or anywhere you get your podcasts. Stay tuned, stay informed.